Are there signs of those severe kinds of cases where a parent should perhaps ask about whether they need to see a specialist like a pulmonologist?
Yes, I think there are a couple a couple of cases, but I think one of the things I ask people to look at is the asthma control. And so if the parents start to see that the asthma is not controlled, maybe that's the time you need to get a second opinion or be evaluated by a pulmonologist. Uh, uh, Tips of when a person's asthma is not controlled, if they're waking up at night, if they're having to use the short-acting inhaler, albuterol, much more frequent than they normally are. They're going through one of the albuterol inhalers in a month's time, or either more than two. Having using two inhalers in a year's time is probably the maximum that you would like to see if asthma is controlled. If you're using more than that, that's probably the time you want to see a specialist. Or if there are other things that are happening, like a person, a patient, or a child is not growing properly, at the same height, or having lots of bronchial infections, maybe that's the time you need to see a pulmonologist to see what else may be taking place.